What is Reiki? The term Reiki comes from the Japanese words rei, meaning universal, and ki, which means vital life force energy that flows through all living things. Some practitioners describe Reiki as acupuncture without the needles. Reiki is a complementary health approach in which practitioners place their hands on or just above different areas of the body. It's based on an Eastern medicine belief that living beings have energy fields that support their health and vitality. Energy blocks, on the other hand, impede innate flow of energy. They cause not only health problems, but also negative life circumstances like financial troubles or relationship problems, according to belief. Energy blocks of any living being can be treated, according to belief, which is why some practitioners also work on animals and plants. Reiki practitioners focus on sensing energy blocks and moving the energy for the greatest good of the client. Now, Reiki is used all over the world, including in hospitals and hospices, to complement other forms of health treatments. Reiki aids in healing by helping people become energetically balanced, physically, emotionally, mentally and spiritually, Bodner says. The history of Reiki. There are at least 30 slightly different branches of Reiki, but Usui is by far the most popular form. Usui is the method practiced and taught in Japan as early as the 1900s by Mikao Usui, who is credited as the founder of modern Reiki. Usui Reiki came to the West via Hawaii in the 1930s thanks to a Japanese-American woman named Hawayo Takata. She traveled back to her native Japan to seek healing for her own physical and mental ailments. They included a lung condition, asthma and a nervous breakdown after the death of her husband. One of Mikao Usui's students, Dr. Chujiro Hayashi, taught Reiki to Takata. Her healing experience was so profound that Takata returned to Hawaii and became the first person to teach Reiki in the West. However, due to the abundance of anti-Japanese and anti-Asian sentiments in the United States around World War II, Takata shied away from using the name Reiki. She had instead referred to her establishment on the island of Kauai as a healing studio. Takata modified some of the teachings for her English-speaking students and ended up training 22 students in Reiki as we know it today. Today, thousands of people worldwide are trained in Usui and similar Reiki methods. Risks and side effects of Reiki. Multiple studies report no adverse effects of Reiki, likely because it's a non-invasive treatment. Practitioners note clients usually report feeling relaxed after a session, but some feel energized. Depending on the nature of the problem, some clients also may feel more emotional or have other intense feelings in the days or weeks following a session. While there is a professional code of ethics that governs Reiki practitioners, there are no licensing boards like there are for doctors, nurses or even hairstylists. Reiki Master is the highest level of training, but there's a wide range of training and expertise among practitioners. Practitioners and clients. To ensure the best result, practitioners advise clients to do their homework. They can ask a practitioner about their training and credentials, but also find someone they connect with and trust. One potential risk is that clients can misunderstand the role Reiki should play in a treatment plan. Reiki practitioners work as a complement, not a replacement, to the medical care a patient receives. Reiki is also not a practice intended to instill doubt in other medical treatments and interventions. Clients are strongly discouraged from viewing Reiki as a substitute for medical doctors, surgery, therapy or prescribed medications. Clients should also be aware that while Reiki, like yoga or meditation, may have roots in spiritual practices from long ago, modern Reiki is not a religion. Practitioners and clients come from all walks of life and belief systems. Receiving Reiki is not intended to interfere with or change a client's spiritual or religious beliefs. Reiki caveats. National Center for Complementary and Integrative Health says, Reiki has been studied for a variety of conditions, including pain, anxiety, and depression, but most of the research has not been of high quality, and the results have been inconsistent. But, scientists who study Reiki beg to differ with that assessment. They say institutions simply need to catch up with the rapidly evolving science. According to neuroscientist Natalie Dyer, Ph.D., president of the Center for Reiki Research, a nonprofit that aims to advance the scientific knowledge and study of Reiki. At this point, there are probably 60 or more published studies that I can point to that show Reiki's benefit. And yet there's still this persistent myth that no credible science backs Reiki. Dyer acknowledges, however, that some studies have lacked rigor and some have not found statistically significant benefits with Reiki. She calls for more high-quality research to understand the practice, how it works and its limitations. In the Yale study of Reiki following a heart attack, researchers note that it's unknown whether the beneficial effects of Reiki treatment over music stem from the presence of another person, the presence of a person with healing intention, the light touch technique, or a combination of factors. Like any intervention, Reiki practitioners warn it isn't a cure-all and shouldn't be viewed as such. But it's deemed safe and potentially effective enough that a considerable number, 15% and growing, of U.S. hospitals offer Reiki healing specifically. Leading institutes like Yale, Harvard, the University of Minnesota, the University of Arizona, UCLA and others offer Reiki as a complement to medical interventions. What to know before getting Reiki? Before scheduling a session, it's important to consider the potential disadvantages of Reiki. This will help make you a well-informed decision. Possible drawbacks of Reiki include limited scientific backing. Although Reiki has been practiced for many years, there's insufficient evidence to prove its effectiveness. Most of the existing studies on Reiki have shown inconsistent results. Science is yet to prove that the body's energy field exists. Even if it does, no scientific techniques can measure how this energy might be transferred or balanced. It's unregulated. Reiki therapy lacks formal regulation. No one organization sets nationwide standards for education, training, credentials, certification. People without a background in healthcare can become Reiki practitioners. Also, different practitioners can receive certification based on different requirements. The reported benefits of Reiki are inconsistent. And receiving Reiki is a subjective experience. It's difficult to predict how or what you'll feel. It's said that people have better results when they're more open to the potential of Reiki. As a result, being skeptical of the practice could affect your experience. It does not treat specific conditions. Reiki is not an alternative for medical treatment. It doesn't treat any diseases or disorders. Instead, it aims to promote overall wellness. If you have a disease or disorder, it's still important to get appropriate medical treatment while getting Reiki. Reiki therapy has been practiced for about a century. Yet, it's occasionally been associated with side effects like discomfort and tiredness. There's also limited scientific evidence and regulation behind the practice. Other potential disadvantages of Reiki include inconsistent results and paying out of pocket. It also doesn't specifically treat any conditions.